Acne scars can be not only unsightly, but also emotionally distressing for many individuals. While there are various treatments available to address acne scars.
Ever find yourself feeling overwhelmed by the myriad of acne scar treatments out there, especially the ones that seem a tad too invasive? First up, we have topical treatments. These are a more conservative approach to handling acne scars. They typically involve the application of creams, gels or serums, ingredients known to promote skin healing and collagen production. Think of retinoids, vitamin C, niacinamide, and hyaluronic acid. While topical treatments may not provide dramatic results as quickly as more intensive treatments, they can still help improve the overall appearance of acne scars over time. Next,
and affordable options for treating acne scars is over-the-counter creams and gels. 1. Over-the-counter creams and gels, one of the most accessible. These products typically contain ingredients such as retinol, vitamin C, or hydroquinone. 2. Chemical peels. Chemical peels are another popular option for treating acne scars. During this procedure, a chemical solution is applied to the skin.
We move to chemical peels, a solution containing acids such as glycolic acid, salicylic acid, or trichloroacetic acid is applied to the skin to exfoliate the top layers and stimulate collagen production. Chemical peels can help reduce the appearance of acne scars by promoting cell turnover and revealing smoother,
superficial peels, such as those containing glycolic acid or salicylic acid, which causes the outermost layer to peel off, revealing smoother, more even-toned skin underneath. 3. Microdermabrasion. Microdermabrasion is a non-invasive procedure that uses a device to exfoliate the top layer of skin, helping to reduce the appearance of acne scars. It can still provide noticeable improvements in skin texture and tone. 4. Microneedling. Microneedling is a minimally invasive procedure that involves
another minimally invasive treatment that uses a handheld device with tiny needles to create micro-injuries in the skin. These micro-injuries stimulate the skin's natural healing response, leading to increased collagen production and improved skin texture. Microneedling can be effective in reducing the appearance of acne scars, particularly rolling and boxcar scars.
Using a device with fine needles to create tiny punctures in the skin. This process stimulates the skin's natural healing response, promoting collagen production and skin regeneration. Over time, microneedling can help. 5. Natural remedies, for those who prefer a more natural approach to skincare. Several home remedies and natural ingredients may help reduce the appearance of acne scars. These can include ingredients such as aloe vera, honey, lemon juice, and tea tree oil, which are known for their skin-soothing and healing properties. While natural remedies may not provide rapid results, they can be a gentle and cost-effective option for some individuals. 6. Laser therapy. While laser therapy is considered a more intensive treatment option for acne scars, there are also lesser forms of laser treatments that can be effective for milder cases. These treatments typically require multiple sessions, but can help improve the appearance of acne scars with minimal downtime.
The lesser treatment processes that can help improve the appearance of acne scars and boost self-confidence. Moving on to laser therapy, a more advanced treatment option for acne scars. It uses focused laser energy to target and resurface the skin. Different types of lasers can be used to treat various types of acne scars. Laser therapy can help improve the appearance of acne scars by promoting collagen production and smoothing out uneven skin texture. Lastly, we have platelet-rich plasma, or PRP therapy, a natural treatment option that uses the patient's own blood to stimulate collagen production and promote skin healing. PRP therapy can help improve the appearance of acne scars by stimulating tissue regeneration and promoting a more youthful skin texture. To sum it up, there are a variety of less invasive treatments for acne scars that can help improve the appearance of skin texture and boost self-esteem. From topical treatments and chemical peels to microneedling, laser therapy, and PRP therapy, these processes provide a range of options to consider based on individual needs and preferences. Remember, finding the right treatment for your skin may take time and patience, but with consistency and care, you can see improvements in your skin's appearance and feel more confident in your own skin.
In conclusion, lesser treatment options, such as over-the-counter products, chemical peels, microdermabrasion, microneedling, natural remedies, and mild laser therapy can offer effective solutions, vary depending on the individual's skin type, the severity of scarring, and other factors. For more severe or persistent acne scars, a consultation with a dermatologist or skincare specialist may be necessary to determine the most appropriate treatment plan. Additionally, it's essential to follow a consistent skincare routine and practice good sun protection to maintain the results of any treatment for acne scars.